Welcome back to Mountain Connections. Right now we are speaking with Dr. Wing Province. He is the medical director at Park City Hospital. Dr. Province, it's good to connect with you virtually. How are you doing?
Doing well, Christine. How are you doing this morning?
Doing great. I'm very happy to have you here with us. You recently returned from a deployment to New York City. We'd love to hear what you learned, your experiences there, and how that will help patients and caregivers here in our local community.
I'm happy to share.
So what are some takeaways from your experiences in New York? Obviously, things are much harder hit there. What are some of the main things that you learned that you're bringing back to your hospital community?
It's a great question, Christine. I got to say, I'm very grateful to be back. I had an incredible experience out there, one that I will never forget. And some of the lessons I'll never forget, I hope I can bring back to our caregivers here in Summit County and in Park City Hospital and in Heber Valley Hospital. One in particular that jumps out is that the personal protective equipment works. Starting in March, saw several dozen COVID positive patients here in the Wasatch Back. And then when I went to New York, probably took care of 20 to 30 COVID positive patients every shift that I was out there. So ultimately saw hundreds of patients. I've been tested 3 separate times, and despite going into the epicenter of it all, I have come back COVID negative every single time. So I can certainly attest to the personal protective equipment, and if we adhere to those guidelines, we can stay healthy. I also say I learned a lot about how to manage these patients, and as it relates to those who may be watching the show, you probably heard a lot about patients with COVID-19 being placed on ventilators. And the data has recently showed that when a patient is placed on a ventilator, if they need that support with their breathing, that the mortality rate is actually pretty high with that. Most recently, I saw 88% mortality, which means about 88% of the folks who are put on a ventilator don't come off of it and end up dying. We tried to stave that off as much as we could. I worked at New York Presbyterian Health System and worked in one of their hardest hit hospitals out there. We served the South Bronx communities, and we had a lot of patients who came into the emergency department there who, say a month ago, my colleagues in New York said that we would have put them on a ventilator. We found other techniques to stave that off and to prevent that if possible, and found ways to get people's oxygenation levels up without having to put them on those ventilators, and we're quite effective with that. And so if and when the surge hits us here in Utah, I bring that knowledge back and have shared that with my physician and nurse colleagues and respiratory therapists here, so that potentially we can avoid having to utilize that resource, number one, and number two, having unnecessarily potentially putting patients on a ventilator, which I think is very promising for us. I think a sad third lesson that I learned that also will relate to our those who may be watching this show. I unfortunately, on essentially every shift, saw maybe 2 or 3 patients die, and a lot of those patients came from nursing homes. In fact, the majority of them did. Unfortunately, the nursing homes were impacted quite extensively, and a lot of the patients who were coming from the nursing homes had completed their goals of care. In other words, their desires not to be resuscitated, no CPR, for example, and they also expressed the desire to not be intubated before they came in. And so we have these patients who were essentially slowly dying from this horrible disease. And one thing that I learned that harkens back to the time that I spent in ICUs when I was in residency was the ability to initiate palliative care in the emergency department. The hospital was so full that oftentimes I would submit a request for a patient to get a bed upstairs where they could be with a palliative care physician who could help that patient die comfortably, and oftentimes they would stay in the emergency department for 8 to 12 to up to 20 hours because of how full the beds were upstairs there in New York City. And oftentimes in my first two shifts, I thought that that was the only option, was to have them waiting and waiting and waiting. I soon learned after about my third shift that I personally could start comfort care in the emergency department for those patients who did not want to be resuscitated. And as sad as it was, I found that it felt empowering, and to allow my patients to die comfortably and die with dignity. And sadly, because of the visitor restrictions that we had there in New York, like we have here at Park City Hospital and in Heber Valley Hospital, a lot of the times these patients were were dying alone, and I or the nurse or both of us were the only people in the room when these people took their last breaths, and I would hold their hand, provide them with those medications that would allow them to die comfortably. And even though it was a sad moment, it was also a happy moment because we could finally see these patients departing, but doing so with dignity and with comfort. And their family members were very grateful to us for being able to start that in the emergency department. And I'd say the last lesson I learned for my fellow caregivers here on the front lines is the very important need to ask for help and know when you need help. The emotional and physical toll that we experienced there in New York was very significant, and in fact, a tragedy hit on the 11th day that I was there. Our medical director for my hospital, her name was Dr. Lorna Breen. She was there when the pandemic hit and oversaw the chaos that ensued when her department was filled with, at some point, 60 patients in a 25-bed emergency department, most of who were very sick. And she saw many of those caregivers, physicians, nurses, physician's assistants, becoming ill with this disease. And unfortunately, on that day, on the 11th day I was there, the New York Times announced that she took her own life. And I was there to see all these caregivers who knew her well mourn her loss. And so in that moment, I realized the very real toll this pandemic can take on those of us who are working the front lines, and learn the importance of being able to be self-aware and the need to ask for help. And I've encouraged my fellow caregivers here to recognize those signs, and very fortunate to work for Intermountain Healthcare, who has a great network of support for us here. And that's certainly a very important lesson that I learned, and hope that we never have to realize here in Park City and in Heber Valley.
Very hard, tough situation in New York, difficult experience that you had, that many people are having in that part of the country. But we're very thankful, Dr. Province, that you were willing to go to help and then bring back what you learned to our community here and share about it. I'm curious, as our county here and our state eases restrictions, businesses start to open, any advice on how we can keep ourselves safe?
Absolutely. I think just as I listened to the experts on this and followed their counsel with adhering to the guidelines that I needed to in the hospital, I think we can do the same as we're out and about in the community. It's interesting because, Christine, when I left in mid-April, and as I watched the news from around the country, the country was really banding together to fight this pandemic, to keep as many people alive as possible. When I went to New York, I'll be honest, I didn't have time to watch TV or the news. It was basically go to work, come home, eat, sleep, and go back to work. And so as I returned to Utah and began to start watching the news again, it was interesting that in those 2+ weeks that I was gone, that this topic, this pandemic, had suddenly become a political issue. And I'm saddened to see that, because I can assure you that when I was in New York and saw so many people dying, this virus didn't really care if somebody was a Democrat or Republican, didn't really care about their political leanings. It was apolitical. It was blind to whatever leanings these patients had. And unfortunately, I'm seeing here in our own community, in our own state, behavior where it's as if this virus doesn't exist. And I think it's because we've been so protected from what happened in New York and in New Orleans and in other epicenters throughout this country and others around the world. I see people who aren't wearing masks, who are not socially distancing, and who are essentially disregarding a lot of those guidelines because of how safe we've been. An analogy I like to make to that is as if someone jumped out of an airplane with a parachute at 10,000 feet, and because they were safe falling for the first 5,000 feet, looked around and said, hey, nothing's happened to me. I haven't died. I guess I don't need this parachute anymore. And they unclip for the last 5,000 feet. And obviously, that would be a fall to their demise. And I'm afraid that if we do the same thing here and think that the very intervention, the social distancing that we did that has got us to this point where we are safe, if we disregard that, it will be like clipping off that parachute for the last 5,000 feet. And
Thank you so much, Dr. Wing Province. We very much appreciate you taking the time to speak with us here at Park City Television this morning and giving us some advice and takeaways from his experience taking care of patients in New York City. Truly, healthcare workers are our heroes during this time. We'll be back with more right after this.